pneumonia is diagnosed similarly, regardless of whether the person is immunocompromised or immunocompetent. But then through a series of questions, the physician needs to understand whether the patient is a normal host with the full complement of host defense against bacteria versus somebody who has cancer or has been on chemotherapy or on steroids, where their body's not going to respond normally and effectively to a bacterial infection. And the reason that's important is that people who don't have a good immune system are at risk for organisms, bacteria that aren't going to bother people who have good immune systems. After all, we've only had antibiotics for 50, 60 years, but we've been fighting off pneumonia for millennia. And so our bodies have very good host defense against bacteria. And so early on in evaluating, determining treatment for somebody with pneumonia, we want to know whether they have a normal immune system or whether they're compromised. Well, so whether they have a history of cancer, whether they have a history of recurrent infections, whether they have some diagnosis, for example, cystic fibrosis or a gamma globulin deficiency that makes them compromised. We review their medication list and see if they're taking prednisone or some other steroid for a condition, and that makes them immunocompromised, or whether they have a history of active cancer and whether they're being under treatment for it. So it's those two things, the medication list, their prior medical history, and what they're currently being treated for. So we have an electronic medical record that is more comprehensive and utilized for quality improvement compared with most hospital systems. Electronic medical records are becoming increasingly frequent across the United States, but for the most part they are data recording, retrieving financial systems at heart, whereas Intermountain system is oriented towards the ability to do what we like to call decision support, of trying to gather data from the electronic medical record, calculate it, present it on a single screen, and be a data gatherer to facilitate the physician making good decisions. Because if physicians are just doing it totally by their own training, their own gestalt, they may not take the time to gather all the information. They may not calculate it in the ways that are literature-based. And so it's a way of gathering and interpreting and presenting information to physicians to make them better able to consistently make decisions that are in the best interest of a patient. So we have implemented it in 4 emergency departments in Salt Lake County. Intermountain Healthcare is a hospital system through Utah. It's a nonprofit healthcare system with about 20 hospitals. And in May of 2011, we implemented this electronic decision support tool in 4 of our hospitals in Salt Lake County. And now we've had about 3 years of experience with it. We continue to develop it. We've looked at outcomes from patients in relation to it, and the trends are favorable, that it's a good idea, it's safe for patients, and we've also had a good uptake by physicians of this tool.